Welcome to Channel 17, the Town of Colonie Government Channel.
Hello and welcome to Focus on Health. I'm your host, Peggy Mello. Today's guests are Dr. Joe Klein and Pamela Mertz. Welcome to the show.
Thank you.
Joe, why don't we start with you? What do you do at the College of St. Rose, and what's your background?
Sure. Well, I'm a speech pathologist, and I'm also an assistant professor in communication sciences and disorders at the College of St. Rose. And really, I got into the field because I had a really severe stutter through my early 20s before I got some really good stuttering therapy. And said, boy, I'd like to do that. I'd like to be a therapist too. So that's sort of how I got into the field.
Okay. And Pam, what about you?
Hi, Peggy. My name is Pam Mertz, and I'm a person who stutters. And I got involved with the self-help movement and stuttering help about two years ago. When I lost a job that I had held for more than 20 years. Mm-hmm. And part of the reason that I lost the job was because of stuttering publicly, but I had always kept my stuttering hidden. And that was kind of like my rock bottom defining moment where I made a decision that I can't live like this anymore and I want to come out of the stuttering closet. Okay. So that's how I got involved.
Interesting. All right, Joe, why don't we start with you? Do you want to give a definition of stuttering? Why don't we start with incidents in the United States?
Okay. Well, it's hard to get exact numbers, but we know that stuttering affects about 1% of the population. As kids, the younger people are, the more stuttering there is. So that preschoolers, we're looking at maybe about 5% of preschoolers stutter. Mm-hmm. And then somewhere between 75 and 80% of children who stutter will eventually grow out of it. And so only about 1% or less than 1% of adults stutter.
Okay, and what's the difference between men and women in the incidence?
Well, just like lots of other speech, language, and developmental disorders, about 3 times as many men as women stutter. So it definitely affects a lot more boys than girls.
Okay, so I think people have their own imagination of what stuttering means, but there are so many different ways one can stutter. Do you want to mention those?
Absolutely. And really what stuttering is blocks. So something like blocks, prolongations where you're actually making sounds mm-hmm. longer than normal, or repetitions of sounds or words. And mm-hmm. Just about all speakers have a certain number of repetitions and some prolongations and very few blocks. But people who stutter have more of them. They last longer than average. And there's some kind of extra physical and mental effort when talking that typical speakers just don't have. Okay,
so it's not just psychological.
No.
It's more physiological as well, right?
Exactly. And typically what happens is that you'll have a young child who starts stuttering mm-hmm. And really isn't even all that aware or bothered by it. And it isn't until the child becomes older and has more experience stuttering and just has a hard time talking, that's when kids will usually start to then have negative feelings about stuttering. And so even though it's most likely a medical physiological problem, eventually it also turns into a psychological problem as people just have a difficult time talking, and that's just hard for people. So.
Okay, so it's not just because they're nervous.
Not at all. Not at all. In fact, we have friends we know who say, I don't stutter because I'm nervous. I'm nervous because because I stutter.
Mm-hmm.
And so it kind of creates almost a snowball effect where the person stutters and then gets nervous about their stuttering, and that extra nervousness makes it even harder to talk, and so they stutter more and get more nervous, and it just gets worse and worse.
And sometimes the nervousness is affected by people's reactions.
Absolutely,
right? So maybe
absolutely.
people who are listening need to have certain things in mind and how to deal with people that are stuttering. Right?
Absolutely, that's
We're going to
really
go more
important.
into that later on.
Yeah.
Why don't we talk about diagnosis? How is one diagnosed?
Okay. Usually for the diagnosis of stuttering, somebody would go to a speech language pathologist, and that's something that we do at the College of St. Rose.
Okay.
And that people can come, and what we really look for, like I said before, with stuttering, will be just that extra effort involved in talking, so that all 3 and 4-year-olds have times where they're word finding, have repetitions, have trouble putting words together, and that's really normal. But then you've got other kids who have either lots of disfluencies or who are really struggling. And then that's where we can say, okay, this is definitely stuttering. This is not just a normal disfluency. And then just to even complicate matters more, most of what I've been talking about so far has been developmental stuttering, but there's also neurological acquired stuttering, where people who are older can either have a stroke, traumatic brain injury, and actually start stuttering later in life as well.
Can I ask Joe a quick question?
Yeah.
When should parents worry if they hear their child stuttering, and what should they do about it?
Okay, that's a really good question. And first of all, parents shouldn't worry if they hear their child stuttering, because it's just how they're talking at the moment. But that if parents notice an increase in disfluencies or any kind of struggle that lasts for more than about 3 months, they should probably either contact their pediatrician or a speech therapist and try and get a diagnosis.
Have you ever encountered any parents who think that it's their fault, that they might have done something or didn't do something to cause their kid stuttering?
Absolutely. That's such a normal thing to see, and I think as parents, anytime there's something wrong with your child, you immediately think it's something that you have done. And so that's one really important thing that we can do as speech therapists at the diagnosis, is just to say, this is not a psychological problem. This is not a problem caused by the parents. This is a true physiological condition. Just like everything else, there are going to be people that are really good, really normally fluent speakers, and then there's going to be a certain percentage of the population that's going to have a hard time doing that. Just like with hearing, with vision, the same is true for speech as well.
So what is the breakdown of your patients? Is it what percent of let's say, under 18 do you have?
Well, at the College of St. Rose, we really have kind of an even split between, we've got preschoolers, we've got school-age kids, we've got teenagers, we have adults, and of course, as kids are younger, it's really the parents who are worried and will bring in the kids, and then as people get older, either as teens or adults, they start to come in because they're either having a hard time talking in school, or it's affecting them at the workplace, as it did with Pam or something like that.
I would imagine if I was a student that stuttered, I might not want to go to school.
Absolutely no. I can remember being younger and pretty much crying every morning to go into school, just because it was so hard for me to go, and I hated talking. I can probably count on one hand the number of times I raised my hand in class from first grade through 12th grade. I probably didn't raise my hand more than 4 or 5 times, just because I knew I'd have a hard time talking, and it's especially at that age, it's no fun being different.
But sometimes when you're not talking, you're a better listener, right?
Right. Well, you can be a better listener, or you can be so upset that you're not talking, that you're not listening to the conversation at all.
Okay.
So
Yeah.
that's bad too.
And I can actually relate to that a little bit, because that's one of the things that I used to do a lot when I was in school. Just like Joe said, I used to really panic being called on in class.
Right.
So where you might think that I would have been a good listener because I didn't talk as much, in fact, what I was doing, I was constantly scanning ahead and trying to prepare for what I was going to say, or try to judge when the teacher was going to call upon me, and I look down and see that, oh, I'm going to have to read paragraph number 6. So I was doing all that in my head and not listening to what was going on. And then sometimes when I did figure out when it would be my turn, I'd suddenly have to go to the bathroom at that point. Or I would find a way to get out of doing that. So all that time that I spent, I wasn't listening. I was pre-planning and trying to ease the panic that I would have of possibly having to stutter out loud and being either exposed or made fun of.
That sounds very exhausting to me.
It can be extremely exhausting, especially if you continue to do it as an adult.
Right. Okay, so what about treatment? What kind of treatment is there out there?
Well, we've got lots of really good therapy out there, and depending on where you go, certain places might focus on what's been called fluency shaping, where you learn to talk more slowly and to just really talk more fluently. And then you also have some types of therapy which can be called more of a stuttering modification approach, where you try to work on the stuttering itself and to make the stuttering much more easy and gentle. And here at the College of St. Rose, we really try to work on a combination of both, and also trying not just to work on speech, but also trying to really work on the attitudes and emotions the person feels. Because if you've got somebody who's already having a hard time talking, and then you're doing all the things that Pam's talked about, the scanning ahead, trying not to stutter, trying to change words, trying to do things. Well, if you have a hard time talking already, doing all that extra things, it's just going to make the problem so much worse. So trying to work on that as well. And then also, depending on the age of the person, really trying to change the environment. And especially if you're working with somebody who's a preschooler and you're working with the family, even though that environment didn't cause the stuttering, if you can, with stuttering, what we believe is that there's really a miscoordination between breathing, voicing, and articulating, or actually making the sounds.
Okay.
And so something happens where maybe the person can breathe while they're speaking, but can't get the voicing going, or can't move their tongue and lips properly. And that with a preschooler, if we can really lessen the demands in the environment, to where the child's not being interrupted, the child doesn't have to speak quickly, the child doesn't have to answer a lot of hard questions. If we can lower demands enough, sometimes the problem that the child has may be small enough, and if we can decrease the demands enough, that the stuttering will just completely go away, and the child can be just a normal, typical speaker. And then as the child gets older and starts to have more attitudes and feelings about their stuttering, that's when we probably have to work more on that, and then also trying to change how the child or the adult actually speaks.
Now, that's a certain kind of treatment. Are there any medications that can be used to treat stuttering?
You know, we are just, it's such an interesting topic. We're just getting to the point where there are drugs now that are going through the FDA approval process to be the first drugs available for stuttering. There isn't anything currently FDA approved to treat stuttering yet, but hopefully those are on the horizon. And it looks like what those drugs can do is, for about half the people who stutter, it's going to reduce the severity of stuttering by about half. So it doesn't help everybody who stutters, and it doesn't cure the stuttering. You know, just like high blood pressure or like any other medical problem out there, this isn't something that can be cured, but it's something that can be managed really well. Mm-hmm. And so it probably won't be long before really good management of the disorder isn't only speech therapy, but is maybe a combination of speech therapy and some kind of pharmacological treatment.
Okay, that's interesting. All right, Pam, we're now going to talk about coping. Mm-hmm. And I know that you talked to me a lot about how a person that stutters copes with a disorder. Why don't you talk about that?
Sure. I guess what I would like to start with is maybe just a brief history of why I chose to become what's called a covert stutterer. And in order to do that, let me just define what the difference is between overt stuttering and covert stuttering. Okay. Overt stuttering means basically that you just let it all hang out, and that you stutter openly. People see it, people hear it. Whereas covert stuttering means that you try to keep it hidden, and you go to whatever length possible to not let anybody know that you stutter. Mm-hmm. And that's what I did for many years. And I think it was a result of, when I was younger, my dad did not approve of my stuttering. He was embarrassed by it. He was ashamed by it. Mm-hmm. So he would yell at me and say things like, spit it out, or if you can't say it right, don't say it at all. That early experience, coupled with having been made fun of in school, I think those experiences of realizing that stuttering was bad and it was unacceptable made me withdraw. And I found to escape from possibly being hurt or made fun of, I found it was easier to try to pretend that I didn't stutter. So I began the scanning and the word substitution and the avoidance early on to protect myself. And I did that through most of my adult life. Never admitted to anybody or myself, really, that I stuttered. And didn't want to talk about it, and I would come up with excuses. If something came out funny, I would, cough or cover my mouth or blow it off, and I didn't want to admit that that's what was really going on. Mm. But as you mentioned earlier, it takes a huge amount of energy to constantly be one step ahead and constantly be thinking about what am I going to say and how other people are going to react to that. I just reached a point, especially when I had a bad experience at work, that I just decided I'm not being true to myself. I'm losing out on so many opportunities in life. I just don't want to do this anymore. So I think actually what I've been doing over the last two years is almost recovering from being a covert stutterer. And when I found the College of St. Rose and their support group and their resources two years ago, what I really needed to work on was acceptance. And the college program was able to allow me to do that. And instead of working on fluency shaping or stuttering modification, mm-hmm. what I've been really working on is just accepting who I am and recognizing that I can still be an effective communicator whether I stutter or not. And that's kind of what I needed to do and reach the point where I'm okay with stuttering because I can still communicate effectively.
Now, just so people understand what word substitution is, do you just want to mention a couple examples
Sure.
of certain things that you've done?
Unfortunately, I do it often, and even though I'm trying to say that I'm a recovering covert stutterer, many times in the present job that I have now, I work with teachers. And just like I said it now, I sometimes don't want to publicly stutter on that word. So I'll switch and call my colleagues instructors rather than have to risk saying teachers and have that come out stuttered. I'm a coffee addict, a coffee fiend, and I absolutely enjoy getting my Dunkin' Donuts coffee every morning. But I've always hated having to use the drive-through. So when I was really covert still, one of the things that I would do many times, I am addicted to hazelnut coffee.
Yeah.
But sometimes I would go through the drive-through wanting my hazelnut coffee, and for whatever reason that morning the H sound wouldn't come out comfortably or well. And I didn't want to stutter on the drive-through window. So I would order French vanilla coffee because it would be easier to say that day, and I hate French vanilla coffee. But I did that many times because it was easier. And now I'm realizing I don't want to do that anymore. If I want to order hazelnut coffee and it takes a couple seconds and I hesitate on it, so what? I need to order my hazelnut coffee because that's what I want.
That's interesting. Now, Joe, do you want to talk about what schools can do for students that suffer from stuttering?
Sure, and there are so many things that schools and school speech therapists can do, and that, to me, probably the most important thing that schools can do is to help a child be really functional in the classroom, in the lunchroom, at recess, and depending on how many students the speech therapist has to see, it can be really hard just to work on being able to be more fluent, because that can take a long time, and often it has to be very intensive therapy. But the things that the school can do is to really create a dialogue between the child and the classroom teacher, between the child and his other friends, his or her friends in the classroom, so that instead of things like Pam and I talked about, where you hate going to school, you hate talking, you hope you're not called upon, you're getting teased, to where the child can participate in class and can be an active member in the classroom whether or not they happen to stutter. Because that has to be the goal at school, is that they're fully getting their education and that they're fully participating, just like any other student. And just like Pam said so well, you can be a great communicator even though you stutter. All of us know lots of people who are fluent who aren't very good talkers, and yet both Pam and I know lots of people who stutter who are great talkers even though they happen to stutter.
Now, Joe, do schools know enough about stuttering to really provide that support that the kids need? Right,
and what's hard is, we're talking about a disorder that only affects maybe 1% of the population, and that you've got lots of kids who are doing what you said, Pam, and trying to hide it. And so there are lots of kids out there that aren't even on caseload who are stuttering, pretending not to stutter. And so most of the people that speech therapists see have an articulation disorder, a language disorder, so they don't get to see that many kids who stutter, and often treatment might not be as good as it could be in the schools, which is a shame.
That's too bad. Now, Pam, you have some tips for listeners. And
Absolutely.
Actually, you taught me a few things, so why don't you mention some of those?
It's really important for people who stutter to teach people that don't stutter to listen well, and I really believe that that's one of our responsibilities. when you come across a person that stutters, sometimes it may be the first time that you've listened to a stutterer stutter. And because you might be caught off guard or you might feel embarrassed by what's going on, sometimes what people will do will be to look away or not keep and maintain eye contact. So it's really important that when you are engaged with a person that stutters, or as a matter of fact engaged with anybody, maintain eye contact. Show interest. If you don't understand something that the person who stutters says, ask. It's fine to ask that. We want to make sure that we're getting our point across. Mm-hmm. Obviously, don't laugh. And sometimes that happens when a person doesn't even mean to laugh, but because they're uncomfortable or a little nervous, a person might actually giggle or laugh a little bit because they don't know what to do. And probably most importantly, don't finish our sentences for us. A lot of people think that that's really helpful if I get stuck or if I look like I'm looking for a word, and you might think that that's a kind thing to do. But as a matter of fact, people who stutter find that disrespectful because you don't know what's on my mind and you don't know what I think, and just wait the extra 30 seconds and let me get it out.
And don't ask them to not be nervous, right?
Absolutely. Don't suggest that we slow down or take a deep breath, or just don't be nervous about it, because if we could do that, we would do that. And again, as Joe mentioned, it's not a psychological problem. Stuttering isn't caused by being nervous, but stuttering can cause us to be more nervous.
Yeah. It's also, I think, really important just that people realize that stuttering, like we're saying, is just a normal problem. Mm-hmm. That, you've got people that have a hard time with vision. You have people that are hard of hearing. Well, we're hard of talking, and so it will take us a little bit longer to say what we have to say, but that's all it is. Mm-hmm. It doesn't say anything more about us except for that.
And one thing that Joe likes to say, and I've been trying to do it more myself lately, it's okay to stutter. And people need to know that and really understand that it's okay to stutter.
Now, you have compiled a list of famous stutterers.
And
now, why don't we mention some of the names?
Mm-hmm. We've got people like Carly Simon, Mel Tillis, James Earl Jones.
James Earl Jones, it's hard to believe.
Darth Vader of Star Wars.
Bruce Willis.
Mm-hmm. Mm-hmm. Joe?
Bruce Willis. Tiger Woods, when he was younger, stuttered, as did Johnny Damon. Winston Churchill was a lifelong person who stuttered. It's really interesting to go back and listen to his speeches, and you can hear Winston Churchill pretty openly stuttering, giving his radio addresses and things like that. And also, at least as a child, Marilyn Monroe was a person who stuttered, and it's even possible that her light, breathy voice was actually used to compensate for her stuttering.
So somehow people are able. I don't. That's what I don't understand. How is it that moving air differently or speaking differently, you're not stuttering? That's what I don't get.
Well,
how does James Earl Jones do it?
All right, I wish I understood that more as well. But what ends up happening is just that. Because there is a miscoordination of those three processes of breathing, of voicing, and of articulation, if you can do something different, if you can, for people who stutter, if they speak with an accent for a short period of time, they're going to be more fluent just for a short period of time. If people who stutter are, lots of times if people are on the stage and maybe projecting their voice more, it's going to change how they're breathing, how they're voicing, how they're pronouncing the words. And often people who stutter on the stage are going to be more fluent. Often people who stutter, not everybody, but lots of people who stutter while they sing, again, we've got a great change in breathing, in rhythm, in voicing, in articulation, are going to be fluent while they sing. And so it's that everyday normal voice. It's people's normal voice that's actually stuttering, but that if you can really change the way you speak, you can, not all people who stutter, but some people who stutter can find a place where they are fluent.
So Pam, somehow you could sing at Dunkin' Donuts and order your coffee, right?
And people would think she's insane.
Yes, absolutely. So I don't know if I would want to do that, but for the record, I do pretty much order hazelnut coffee now every morning, and if it comes out a little bit stuttered,
you're
that's
overt,
okay.
It's okay.
I'm overt, and it's okay.
Good.
Yep.
All right, we have further resources to discuss. Joe, why don't you start with the contact information for the College of St. Rose?
Sure. If there's anybody out there who stutters or who knows somebody who stutters, please feel free to contact me, area code 518-454-5205. Or they can also just contact the College of St. Rose and ask to be connected to the Winkler Speech and Hearing Center as well.
Okay. And Pam, you have a phone number for the support group
Yes.
for the National Stuttering Association, right?
National Stuttering Association can be reached nationally at www.westutter.org.
Okay.
But we also have a local chapter that meets once a month at the College of St. Rose, and folks that would like to find more information about that can call 518-229-8989.
Okay. And two other websites. The National Association of Young People Who Stutter is...
That's called
Friends?
Friends, and that they can be found at friendswhostutter.com.
Okay.
It's actually friendswhostutter.org.
.org. Oh, all right,
yep.
great. Thanks for
Okay.
correcting that.
Yep.
And the Stuttering Foundation of America, stutteringhelp.org.
That's
Yep.
right. That's right.
Okay.
Great.
I think we did everything.
I think so.
Right.
That's great.
Thank you very much for coming in today.
Great. Thanks.
Thank you, Peggy.
Thanks.
Thanks for watching. We hope to see you next time on Focus on Health.
Welcome to Channel 17, the Town of Colonie Government Channel.